I'm Jim Berenson. I'm president of the Berenson Cancer Center, and I'm also the founder and CEO of the Institute for Myeloma Bone Cancer Research in West Hollywood, California. And it's my pleasure today to tell you about a recent paper we published in Hematologica, in which we looked at the outcomes among all of the patients who we've seen in our clinic who initiated therapy there. That is, their first treatment was there. So this was 175 unselected patients, and we want to determine their overall survival and also look at their progression-free survival. And what we learned is that without the use of transplant in any of these patients in frontline and just one in second line, or CAR-Ts or bispecific antibodies, our average survival now, our median, is at 13 years. And it turns out that progression-free survival was but 20 to 30 months, and that did not really predict overall survival. And in addition, the depth of the response, the genetics, some of these things that are routinely used to predict outcomes, in our clinic, they don't really predict survival. And I think the reason is because we're very hands-on, we're very quick to respond, and also we have a plethora of different possible treatments for our patients. So this is the longest survival reported by any clinic in the world in unselected patients. So we're very proud of those outcomes, and they only will improve over the next few years.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.